Welcome to the Vet Dental Show. I'm Brett Beckman. I'm a board certified veterinary dentist, and we come to you every week on Wednesday to provide the veterinarian and the technician team some actionable things that you can use in your practice. And this episode is going to be a recorded episode that we've done in the past, not a podcast that we've recorded or not the Vet Dental Show, but actually some other information for you that we know you're going to enjoy. So sit back, enjoy, and we'll see you at the end of the podcast. So Leo, what is the harm in extracting large multiple root teeth without creating a flap and leaving them closed by second intention? We've got a similar question here. Should we always close every extraction? And sometimes the doctor leaves it open to drain if it is pus. Should these be closed? So both very similar questions. If we are at this introductory level, that's super common, and I appreciate your questions and I appreciate your honesty in presenting both of these questions. If we have some degree of veterinary dental education, and this is the first exposure that a lot of you have, and this sets the groundwork for going forward, especially on this topic. So from that standpoint, if we're practicing dentistry the way it's supposed to be practiced, the way that AHA says that we should practice it, the way that the American Veterinary Dental College says that we're supposed to be practicing it in veterinary practices around the country, around the world, we have someone or a team of technicians or doctors or both that can do radiographs quickly and efficiently. And by that I mean 8 minutes or less for a small dog, 15 minutes or less for a large dog, with either 10 images or 15 images. That's the first component. The second component is the doctor that can do surgical extractions quickly and efficiently and read the radiographs that the tech or the doctor, or maybe them, take and come up with a diagnosis quickly and go right into the procedure and do surgical extractions by lifting up a flap, which exposes all of the debris that would be left if we just extract the tooth and let the pus drain. There is no pus in most of those extraction sites. There's a lot of food debris, and there's a ton of bone osteomyelitis and infected tissue in the socket where the bone has been lost. But from the standpoint of pus draining, that non-cleaning of those extraction sites does nothing but make the patient feel a little better. You need to be able to go in, surgically extract with flaps, clean, which is the biggest part of the benefit to the patient, close those extraction sites, and then send that patient home disease-free. When we do that, there is zero, and let me reiterate that, zero sepsis from the point of closure forward. If we leave all of that debris, that sepsis continues for months to years, if not the life of that patient. And so the patient still is getting showered continually with bacteria, and this is backed up with research. We know this in humans. We know this from the standpoint of our veterinary patients in certain studies, especially one that was done at Wisconsin that showed the patients do not have sepsis after closure if it's done correctly. So that's probably the most important point that I want you guys to take home today, is that particular thing. We're not doing these patients any good by cleaning teeth, and that's all we're doing. We're not doing these patients any good from a long-term and a sepsis standpoint and a healing standpoint quickly by extracting teeth and leaving the extraction sites open. Now, there is an exception to that. That being said, let's go to the next. Any tips for extractions where there's ankylosis or resorption to help breaking root tips? ankylosis and resorption. So resorption we can kind of put on the back burner. We'll talk about that with tooth resorption. Resorption doesn't need to be extracted if there's complete replacement resorption. We've got another discussion on that later. But when you're looking at preventing breaking root tips, there's a couple things you can do. Number one, you should have proper training. You need to be able to be comfortable removing vestibular bone to the point where you can make a good assessment of the outline of that tooth. You can see the mesial and distal tooth and bone interface from that exposure with the vestibular bone removal with your diamond football burr, and then making those grooves that are deep enough but not too deep, and then using nice sharp elevators in order to get that accomplished. And I used to really struggle with efficiency with elevators. I had done it for years and I got tired of it, especially trying to see those little numbers that are on the handles of any of the luxator elevators that are out there. And as far as extracting or recommending sharpening elevators, we recommend that you do that, as I mentioned, once a week. If not, every time that you use them would be great. And certainly most of us don't have time, or most practices don't have time to do that after every procedure. So once a week or at the end of the day certainly is another option for you. And there are videos in our technician online course that'll show you how to do that. And there are videos in some of the other courses as well, but that one specifically. And that technician online course is also consistent with the level 1 course that we do for veterinarians and technicians, so it's certainly great for veterinarians as well. So I think the question on this was, how do you get good exposure? And I may have overlaid that onto the question, but how do you get good exposure? You use a periosteal elevator, and that periosteal elevator is used to provide exposure to the entire length all the way to the apex of that tooth. So if you've got a canine like this that has no periodontal disease, you can go all the way to the apex if you need to remove bone and make this an easy extraction. You don't have to do that all the time. You don't have to do that in this case, but quick, efficient extraction involves removing as much bone as possible. And what's going to happen is that is going to have a blood clot in it when you close. All that's going to fill with bone again. That's going to be solid bone in 4 to 6 weeks. So removing more bone doesn't mean that you're compromising the patient. It means that this is going to fill with bone in 4 to 6 weeks, unless there's an oral nasal fistula, and then that will fill with fibrous tissue and or some bone, and will not be an issue either way. A recent study has shown that simple continuous is used in this study and is quicker than cruciate, is quicker than simple interrupted, and just as effective. I don't recommend it for entry level to intermediate veterinary dental practices that are doing extractions, because you have 2 sutures there. And the apposition of the wound edges is not quite as nice as it is if you do simple interrupted or cruciate, particularly simple interrupted, where you can put those sutures 2 millimeters apart, maybe 3 millimeters in a large dog, have them nice and close, have those wound edges opposed nicely. So I would strongly discourage that, and a lot of my most of my colleagues do not do simple continuous. I borrowed this from our European colleagues who have been using it for years, and I was kind of the lone wolf starting this, as far as I know, 10 years ago or so. And most of my colleagues, I think, still don't use simple continuous. So if they're not using it, it's probably not a good idea for entry level to intermediate people doing extractions in practices to use it either. So a little footnote to that. So Kristen, are greenies comparable to Orvet chews for dogs regarding plaque prevention? That's a good question. And from that standpoint, both of those are chewable. They're both safe based on the studies and based on clinical evidence. Greenies wasn't for a while. They reformulated years ago, and now they do digest. Not to say that they couldn't cause problems either way if they're swallowed whole. We don't recommend you just for the first several times give your pet one of these and not have them attended and you watching them and how they manage those. If you have a dog that just takes a couple bites and swallows, that's not something you want to give them, because you're asking for potential problems even though they say that they have been proven to be digestible. So that being said, greenies, when you chew food or any treat, those greenies included only get the caudal cheek teeth. And the same thing with Orvet, but Orvet has that wax component that is distributed with the saliva, with the tongue, with the cheek mucosa around the crown enamel, and covers that with wax. And wax is a lower surface energy than enamel itself. So the lower the surface energy, the less that something attracts other compounds or molecules. So less chance that plaque will adhere to a tooth that has wax on it. And so this gets all the teeth versus greenies just helping with the caudal cheek teeth. That's why we recommend it for our home care. It's also Veterinary Oral Health Council approved, vohc.org, and you can go to that and see all of the recommended home care that is recommended. We also recommend Healthy Mouth Water Additive because it gets everywhere. Research is done by the VOHC on multiple products. It's easy. The owners will do that, and they'll do Orvet. Brushing is ideal, but most owners aren't going to do it. I hope you enjoyed this episode. There's a lot of actionable items in there that you can take and use in your practice immediately. So put those to work and enjoy the benefits for the practice lifetime in your dentistry service. So until next week, have a great week. Take care, guys.